Welcome to the Post-Symposium Community Integration Webinar Series. This presentation, Supporting the Veteran, Offering Holistic Support Through Collaborative Services, is the third of a three-part series. We will begin today's presentation with a short introduction, followed by panel discussion, and then we are going to open the floor up to you guys' questions. The moderator for today's session is Jeanette Gillis, Deputy Director at America's Warrior Partnership. Jeanette is a licensed clinical social worker in Georgia. Her work at America's Warrior Partnership involves assisting the program director with development of program services. Jeanette is also the director of the network. The network provides local veteran-serving organizations with a connection to national resources when a veteran's request cannot be met locally. That's it for me. Jeanette, the floor is yours.
Thank you, and welcome everyone. I would like to introduce my panelists to you. They come from 3 communities around the country and work collaboratively to address veterans issues, and they're going to share their experience, insights, and maybe have some tidbits that they can share with us that may help you in your work around the country. First of all, we have David Chapa. David is the Director and President of the Alaska Coalition for Veterans and Military Families. We have Kari McDonough. Kari is President of Vets Community Connections in San Diego, California. And we have Denton Knapp. Denton is the Director of the Tierney Center for Veteran Services at Goodwill, Orange County, California. So welcome to the panelists. I'm excited to have you, and I can't wait to hear your answers to these wonderful questions. First of all, let's get started with talking about who your key partners are within your community. Why did you select them as a partner, and how do you go about creating relationships? We're going to hear first from Kari. Kari, what are your thoughts on how you all do that there in San Diego?
Yes, good morning, good afternoon to everyone. Thank you, AWP, for putting this together. I think as we all work remotely going into month 7, sessions like this are more important than ever. So thanks for putting this together. Our key partners in our community. For us, we have 4 key partners that have been with us since we first came up with our vision of Vets Community Connection. They include 211. 211, for those of you who don't know, is a 3-digit calling code. Most areas throughout the country have a 211 call line. Some are county-based, which is what we have here in San Diego. Others are multiple counties. A couple in a country are statewide. They get a lot of veteran calls, a lot of questions that need answering, a lot of requests for assistance. And so by having them as a core partner, we can get referrals from them. Another one of our core partners is the San Diego Veterans Coalition, and we're so fortunate to operate in a community that has this coalition. It's really a collaborative group of all of our veteran and military serving organizations. And what is so important about being involved in them is that we can make sure that we don't duplicate services and we can fill gaps, right? The last thing we need to do is confuse the local environment by having multiple people doing the same thing. So we are really keyed into where are those needs and how can we fill them. That's the role of that coalition. Our other key partner are the Chamber of Commerce's. We really work to involve the local business community. And our tip on that is we've learned to involve not just the biggest Chamber of Commerce in the area, which is San Diego Regional Chamber of Commerce, but there's also several local community-owned, community-operated Chamber of Commerces that have been really helpful to us. Lastly, I would say it's the county. And what I've learned most in this work is the incredible role a county plays at the local level in serving our veterans and militaries. I think too often we think of cities playing a big, and they do play a big role, but the county gets overlooked, especially with their role in health and human services. So the county is a huge part of our work in making sure that we fill the needs of our veteran military population. I'll turn it over to the next person. Is it David or Denton?
Denton? Would you like to share with us from your perspective how you do that in Orange County?
For our partners, we have a little different situation. Although we have 130,000 veterans in Orange County, California, our VA benefits is located in Los Angeles, and our VA hospital is located in Long Beach. So we really don't have a VA headquarters in Orange County, so we rely heavily on the nonprofits to pick up a lot of that ability gap. So at the Tierney Center, we actually had some space, so we opened up some rooms to other nonprofits. We really looked at capabilities. So we've got, much like CAR 810C is here, so when somebody dials that in, it rings right to our intake. We've got multiple behavioral health organizations in here, and we've also got Veterans Legal Institute. So a lot of capabilities here in an effort to be able to have veterans come to one place and get things done. As part of our collaborative for the community, one of the focus on is different capabilities, and one is education. So we've actually got a partnership with the Veteran Resource Centers for over 20 different community colleges in the area called Region 8. And we're able to coordinate with them to see who the veteran students are, what their needs are. Some are couch surfing, you know, some haven't eaten in a couple of days, and be able to work through those things. And more importantly for us is employment, as they start focusing using their GI Bill and other assets to do their class. So we look at what their goals are for the future, capability to get from point A to point B, and then looking at graduation on, can we start placing them early so they come out with a job immediately. That's just an example of using the education as part of our partners, public-private partnership. We focus heavily on working with the county's Veteran Service Office, CalVet, which is California's VA, and then the VA itself, and to try to get them to come as many as possible, and really focus on how we can help as private organizations. Thank you.
David?
So the coalition is formally aligned with the State of Alaska's Office of Veterans Affairs, and there are MOAs in place between us and VFW. So and then of course we do have our relationships with the VA and the various different tribal organizations that are necessary to work throughout the state. The state does have a high rurality, and so we do have to have relationships with each individual tribe, especially for working with those veterans who have to apply for benefits in those areas through the Bureau of Indian Affairs. We do a lot of work with the state and with VFW. We provide case management services for their VSOs. And so each individual VSO doesn't have the time. They have such high caseloads that they don't have the time to walk each client through the claims process through the VA, or can't help every client that needs help navigating the resources in the community. So we provide that assistance. We walk them through step by step. We hold their hands the entire way. And I think that's where we've been of most use. And because of where we're situated with the state's Office of Veterans Affairs, or OVA as we call it, we also have the state approving agent in that office. So when education cases come up, she's right next door. And then 2 floors up, we have DVOPS, which is the vocational rehab section of the veterans benefits. So we sort of have, I can reach out and extend my arm and touch our partners. That's how close they are.
How difficult is it in Alaska to work with so many different cultural groups? I mean, it sounds like you've got a lot of different cultural groups and folks up there. So how do you manage that, being sensitive to the different traditions and things?
We find that the best practice is to recruit leadership, and not just external leadership, but trying to implement it within our organization as well. So we're sort of in the process of rebuilding our board, and we're taking a very diversity heavy approach to that, just because Alaska is an extremely diverse place. Beyond that, it is a wide network of different organizations to varying sizes. Fortunately, the VA has done a lot of the legwork and sort of bringing them into one cohesive focus. There are mechanisms and infrastructure in place to help facilitate help for veterans in that community. And we're just sort of uniquely positioned to be able to utilize that.
Yeah. Okay, well, thank you. Thank you. Denton, I would like for you to just touch base before we move on to our next question on how you collaborate with colleges, because I think that's something that you all have worked hard establishing. So can you touch on that a little bit about some hints maybe of how you've done that?
Sure. I mentioned that we do work with the veteran resource centers at all the colleges, over 20 county. Some of them don't have a veterans resource center. And so we kind of serve as the default one for them to be able to come and get services, whether it's benefits or any critical needs emergency. So I do have an outreach section in the Tyranny Center, and that outreach supervisor and her 4 specialists go find veterans. We try as best we can with the Veteran Service Office for the county. Veterans enter and go to get ID cards or start benefits. And we're able to get some of those names from them and meet them in the waiting room. But actually, I send those guys, outreach specialists, out to all the community colleges. We break it into quarters on which college to see. Each one has specific responsibilities. Go start that relationship. So now it's become close enough where those veteran resource center directors will call us if the veteran has some needs and actually send them over to us. We've also been able to provide some scholarship to the veteran students at each of those, and we present those on an annual basis. So it's just some idea about able to reach out to them. Again, we have a Region 8 meeting, which in essence is our education group for our cooperative. And that Region 8 meeting meets monthly. They rotate colleges on where they're going to meet. And that's the venue that we use to address any issues and also talk about resources for veteran students. We're able to pass down newly proposed or approved legislation on GI Bill and other issues that may affect them. And with COVID, it's been an issue because of all the changes with the class structures, how they're going to receive GI Bill and what goes towards that. So it's been important, especially this past quarter.
Mm-hmm. Okay, thank you. I'm going to move to our next question. Our next question is, can you provide any lessons learned when it comes to working with community partners? So any hints, lessons learned, positive or kind of things that we might want to avoid? David, let's start with you for that one.
Okay. So it really depends on the partner. And I think because of where we are specifically, there's been, and sort of the partners that we work with, like the VA and the tribes, there are certain cultural sensitivities, gatekeepers, if you will, to those communities that you kind of have to respect, that there is a way of doing things. There are existing structures that we have to respect. And as much as we might want to wiggle around, bureaucratic obstacles, but it's not always the case, right? It sort of helps to respect those anyways, to make sure that we're being as effective as possible.
Right. So the helpful hint there is know your group, know who your partners are, and respect sort of their traditions and really get to know them so that you work with their cultural norms.
Yes.
Okay. Kari, what do you find in San Diego?
I think, San Diego has so many military and veteran initiatives, which is, a fabulous problem to have. I think one of the key things that we find is effective is to always start each of our conversations with our core partners of what our mission is. Here's what we are attempting to do, because in that we gain their buy-in, because that's their mission too. They are absolutely in support of that mission. If we can remind them of their important contribution to meeting this mission, we have them invested, we have their attention, and we have them committed to move forward. And so I think that's what we try to do at the start of each of our partner meetings, is to really remind them what we are aiming to do, what each of our roles are in meeting that end goal.
Okay. Jen?
On collaboration for working with our partner organizations is humility. You have to have a sense of humility and be able to understand the greater good of helping veterans and their families. We have all the nonprofits. We all have to have money from grants, and they're often grants that we compete for. So being able to look at, if we have similar capabilities, how can we work together, looking at our strengths and weaknesses for organization without stepping on each other. There's an opportunity to go for joint grants at that point, if you can get there, where you look at, instead of 4 different organizations competing for, say, a county health, you can all 4 go together and get one check and figure out how you're going to break that apart. And donors seem to like that. So it's a matter of looking at what capabilities you need to have in your center or with your collaborative. If you have multiple partners that have really competitive nature and similar to how you have to for vets and their families, how do you get past that? And it's about coming in with a spirit of service and attitude, and then really sitting down and looking at, okay, who's going to do what? And how's that going to work within this organization? And then the capability to do case management and case sharing with that coordination. You know, to have a veteran come in and not tell their story 10 different times to 10 different people.
Yeah.
So, Warrior Serve, our database that we use through America's Warrior Partnership, is great for that. We can share it with our partners and partner portals, and that helps kind of pass that veteran story from provider to provider without, you know, with causing least disruption for that veteran and their family.
Right. Okay. So we've got humility and a spirit of service, getting to know that community and respecting the cultural norms, and also sort of making sure that you have buy-in and connection to your partners and that you're all speaking the same language. That's kind of what I surmised from the things that you shared. Before we move on to the next thing, I would like for you, Denton, to talk to us about the Mission Act and how you've worked with that, and if there are some hints that you have for the folks that are listening and how they can access the Mission Act and help the veterans use it.
Sure. One of the issues that, of course, VA has been dealing with, along with us that are working in the nonprofit arena, is regionality. To be able to get resources in the right region, because transportation is an issue for a lot of veterans. In our case in Orange County, we're traveling to the beach to the hospital or for benefits. We've got 3 small clinics in the county that have ability, you know, optometry, hearing, some behavioral health. But then when the Mission Act was passed to enable VA to refer veterans out into the local communities for medical and health needs, that was very important for our locale. So one of the things that we had to take a look at is to be able to use that, you know, veterans would have had to process for through VA to get the 10% to be able to use those services. So what we found is a lot of our older veterans, 9/11, some Vietnam era, had never been to VA, had never filed for disability, and really were unfamiliar with that process and the Mission Act. And we're really relying on ensuring if they were working, if they weren't working with care, and you know, really looking at how we could do that. One of the issues we found in the Mission Act is a lot of hospitals and clinics, civilian side locally, were approved for Mission Act through the VA. A lot of their employees didn't know that. So you'd get a veteran go to the front desk saying, you know, I'm here, you guys are on the list, and the people didn't know what they're talking about, and couldn't help them. So it's both sides information, not only to the veterans and their families, but also pushed down through the providers, that down to the desk clerk, they understand what the Mission Act is and how they deal with veterans that may come in for services. So it's very critical that we start looking at that. And transportation is still a problem to get anywhere, even to the clinics here locally or clear to Long Beach. So Mission Act is very important.
Right. Thank you. Did David or Kari, did you have anything you wanted to add to that with regard to the Mission Act? Didn't really surmise that pretty well. So thank you for that. I think that the Mission Act is something that we all need to know more about, and veterans do, in my experience too, have difficulty accessing it, and there need to be a little bit more communication on how that works and increasing that access. So my next question, what are the ways that you are currently working to help advocate veterans in your communities to cut through red tape? So that sort of springs off of the Mission Act a little bit, that whole red tape thing. But what about other resources, community resources, state resources, VA resources? How do you help the veteran cut through the red tape? Because we all know that is a long-standing issue and problem. Kari, let's start with you.
Yeah, I'm eager to hear what my colleagues say on this. You know, I will say there is no secret sauce to cutting the red tape. I wish I had a magic pill for that one. But I think one of the core things that we try to do is really make sure that we understand the problem and the issue as fully as we can to see if we can come up with a creative workaround. And that's, you know, taking the time to really have that in-depth conversation. So again, that's what I would offer is can we really look and examine this from every avenue to see if there's another thing that we can, another way we can work around. And the other thing is to really constantly reconnect with our resource database. If we have a resource that is not going to return phone calls to veterans, it doesn't matter what their title is. We got to move that person aside and find someone else that we can get them in the door with. I turn it over.
David, what are your thoughts?
So we, from our perspective, we work with such bureaucratic juggernauts that we find that the best way to sort of circumnavigate that system is, as Kari mentioned, coming up with our own solutions. And I think that we might take a slightly more involved approach where, say that we're working to get a veteran compensated for, let's say, adaptive special housing adaptions through the VA. That's a long process. That's not an overnight thing. In the meantime, they might not have heating. In the meantime, they might need help getting into their house, into their car. And that's not something that they're going to get overnight. And so what we've done is started approaching the community for resources on a micro level. So when I have a client who needs something replaced, something not a big ticket item, it's usually in just the low $100 range, we can usually find a business somewhere in the community willing to help that specific veteran out. And from a fundraising perspective, donors eat that up. They're like, oh, I can donate and know that that money is going to be used directly to help this family with this specific need. And we're having kind of a lot of success that way. And so we can help them get immediate help while they're waiting for those claims to go through the VA. More often than not, we end up providing that direct financial assistance. And then we just sort of hammer out our fundraising. We just kind of, you know, the expression around here is, let's just go print more money. Let's go find it. There's money out there. Let's just go get it. And that's sort of the attitude in the office. Let's make it happen.
Yeah. Okay. Denton, how do you manage the red tape within the community and to get access to resources?
So to manage red tape, you have to address red tape. So take a look at what the root cause of the problem is. And for a lot of the benefits and service for veterans, if they're going through the county Veterans Service Office, they're already overworked and overloaded. And what we found was, wait times for veterans to see the Veteran Service Office for the county were taking 4 months, sometimes longer for ability ratings. And so we dug into it. We found out, well, we're 7 and only 3 were working. And so working closely with the government entity to say, we hire veterans on the community. I can give you a stack of resumes of extremely qualified veterans that are willing to do those jobs, get the training, and stay in Orange County and not go work for VA after they get trained or anything like that. So let us help you help yourself and help fill some of those slots. And so it's getting involved. For instance, our county board of supervisors, we're able to go and brief what we're doing. They need to have an understanding of what the veterans' issues are and how long things are taking and the lack of capabilities that we may be able to compensate for at nonprofit agencies. So taking a look at that is just the problem, and then meeting to talk about it. So for our collaborative, we invite the county Veteran Service Office now. Our link representative comes and joins our collaborative meetings. And then also we have VA dialing in from Long Beach and LA for both health and benefits. So it's ensuring that you've tied in all capability providers, whether it's public or private, to ensure that veterans are getting timely service and what they need.
All right. David, can you discuss navigating tribal systems and to solve the tribal populations?
So I kind of have to go back to the what I mentioned earlier about the gatekeepers. It is so there are formal structures in place, right? But it is very social. And there are people in that community who act as gatekeepers for those communities in unofficial capacities, right? It's about knowing who your go-to person is and knowing who they know. And it's not, it doesn't work every time. We're finding right now, working on a case right now, that they're in such a remote location that we're having the most difficult time reaching their actual tribe. And those situations do pop up given the nature of living in Alaska. But basically, I just have to get out there and meet the chiefs. I have to meet the presidents of their organizations. I have to actually know the people in that tribe. And more than that is we have to educate them on why we're here, what we're doing, because it's not, they know what the VA is. They know what the VFW is. And more often than not, they look at us and they're like, okay, if the VA says you're cool, you can come in, but like, we don't really know who you are. So those are some hurdles we have to get through occasionally, but it's all social right now.
So it's kind of like what Kari was talking about with getting buy-in. Yeah. Kind of just making sure that you're getting buy-in. And I think there are gatekeepers in all sorts of communities, but I think particularly with tribal communities, given, go ahead.
Not gonna lie, they can be a little standoffish, rightfully so. I get it, right. And so sometimes that's the uphill battle that we're facing. But we have to actually socialize with them. It's one of those the required part of chit chat before you get to the business. You have to socialize. They have to like you. They have to engage with you in order to get that buy-in.
Right. Yeah, we have an attendee, John Galvin from Wyoming, is saying that sometimes he has that same issue there in Wyoming with gatekeepers on the reservation. So, so really it's about developing, again, developing those relationships, building that trust, helping them understand, sort of like Kari was talking about, why you're there, what you're doing, what your role is, how you can help, and just inviting them to be a part of the process. Does that help, sort of inviting them to be a part of it, or?
So when we're, say, developing programs that will impact those communities, we try to make it the planning process and the implementation of that program as participatory as possible. Mm-hmm. So for example, we're in the process right now of providing laptops to certain tribes and VFW posts throughout the state so that the veterans in those rural areas have a computer that they can use whenever they need it. You know, we've sort of taken all the technical things that they might need to focus on away, and we're going to take care of that. But in the actual facilitation of who gets to use that and where it's at and all of those details, that's up to them. We're just providing them the resource, and they get to determine how it's utilized, and almost entirely.
So giving them ownership.
Yeah.
Thank you for sharing that. It's interesting to me, just as a social worker, to sort of hear your experiences, because you're in a unique position. So thank you for that. So let's move on to the next question, and this is very timely. How has COVID-19 affected the way you achieve your mission? Kari, I'm going to start with you because we want you to discuss the agility and how your organization has recently adapted. It sounds like you've done some proactive things there. Can you start us off with this question?
Yeah. Well, I will say COVID's a lot of things, but it is not a boring time to work, right? We have all experienced such incredibly profound changes in every aspect of our work and our lives. And so I think one of the things, and I was reflecting on this and realizing how often I hear the phrase, the new normal. It comes up kind of almost on every call, the new normal, the new normal. I would say one of the things we found is this new normal is constantly changing, right? COVID impacts that we faced in our community in March and April are different than the ones we're facing right now. Not maybe 100%, but I would say it's close to 70% different. So we have to be constantly reassessing this new normal. And we look at that from our client perspective. We've met with veterans and military members that have never before reached out for resources or reached out for advice and information. It's a whole new group of people, and not all of them are from all ages that we've met with. So we're trying to figure out what are the characteristics of who's calling us on a monthly basis, so that we can do better outreach to that particular population, as well as on our resource side. You know, we've had incredible number of businesses shut down or close permanently. We've had a number of nonprofits also have to close shop already. And we've seen other nonprofits pick up the role that other organizations were working in. So we are constantly relooking at our community to make sure we have the most up-to-date information so that we can share that with our clients. So it's fluid across the board in a way that has never been, right? And we are assessing, I would say from our client perspective, it's really interesting to see the differences that we've had. The first few months we saw an uptick in our older veteran population. I think that a lot of that was due to changes with how they access food, how they access medicine. Now we are seeing an uptick in September from our families with younger children or school-age children as they work to adapt to school at home and figuring out what resources they can add to support their children. Those are avenues that we've never had significant calls in. So it's an exciting time to be working in, and I can get into a little bit later our plans and actions. I turn over to David or Denton to talk about your great work.
Denton, do you want to talk to us about what are you doing in Orange County with COVID-19? How's that affected your community?
So the Attorney Center for Veteran Services is part of Goodwill of Orange County. And so we got the veteran services side on human services, but most of the Goodwill of Orange County deals with 24 retail stores. And so we had major furloughs at the beginning in March this past year, probably about 3/4 of the workforce. I was able to argue to keep the Veterans Center open, not the building itself, but our capabilities from working remotely, because we were funded by grants and donations throughout the whole year, which enabled us to still pay salary to our employees that I have working veteran issues. But one of the most important things is what could we do from home? And we were able to pull up our Warrior Serve database remotely from the house, which enabled us access to our 10,800 veterans in the system. Go through and call them. We broke it up over the last several months, actually, and calling all of them to see if they were okay. And some, you know, it'd been a year at least before they'd come in for services and just see if they needed something new or if they're still seeking employment. So that helped. The biggest thing we had was requests for funds, critical needs, food, shelter before they could get into a VASH voucher, car repairs, childcare, a lot of different things that came up. And so fortunately, we had a good stream of revenue for emergency funds from our habitual donors, as well as American Legion, VFWs, Association U.S. Army, and other organizations that could provide those for us. And it averaged about $500 per veteran in most cases, whether it's 5 days in a hotel or, you know, getting your transmission fixed. So we're able to issue those in the form of checks or purchase card to get those out to the veterans. United Way had a great program that had a large, almost $2 million worth of help for veterans that had lost income due to COVID. They had to be housed, but that was about $500 per family we were able to get out also. So what we found was employment slowed way down. A lot of the subsidies coming from the government were actually more money than a lot of people made. And so we didn't get a lot of requests here in the past quarter or really almost semi-annual for employment. But I see that on the horizon coming soon, that as we start going back to the workforce and places start opening up, people are going to be looking for jobs. If companies decide to downsize due to COVID, and veterans or family members that may have been working there may not have a job now. So that's just some of the things that we found we're able to do from home.
Okay. David, how have you been affected by COVID-19 up in Alaska?
So I was actually taking a look at our service numbers the other night, and it looks like requests for, requests for assistance have increased by 55% this year. We anticipate by the end of the year, it'll probably increase, that number will probably be closer to 100% increase. We found that the number of food insecurity cases that we're dealing with has increased by at least 6%, and that the number of cases where people are facing homelessness, usually because of substandard living or some sort of damage to the house, has increased by 5%. 80% of our clients already were either homeless or facing homelessness, and that number is still increasing this year. We're finding a decrease in requests for employment assistance, so things like vocational rehab or resume assistance. But there's a substantial increase in requests for financial assistance, and sort of the local studies that have been conducted by the foundations here have confirmed what we're seeing, is that most of the veterans in the community are having a very tough time securing jobs that they can perform from home, and as a result, they're at home. They're trying. They want to work. There are jobs out there, but the vast majority of industries. Well, the industries that most veterans in this state are employed in are logistics and oil, and those are some of the heaviest hit industries right now, particularly in this state, because we have to ship everything everywhere here, and we are an oil state. And those are the two biggest employers, you know, in the state, not even just in the veteran community, but in the state at whole. And these veterans, the data is showing they're facing permanent unemployment because of this situation. They're staying outside of the workforce so far. It's having such a detrimental effect. And it's not just the individuals or the families, it's the organizations here too that are reaching out to us for help. A lot of organizations didn't plan to have to secure thousands of face masks for their staff or their clients. We've probably had, what's been requested of us is probably in the range between 15 and 20,000 masks. We've only been able to secure the funding to produce about 7,000 of those. So we've only produced roughly about 50% of the masks that have been requested of us. There's requests coming in every day from other organizations that are needing help. We actually employed 20 military spouses who lost their jobs when COVID hit back in March. And they just all happened to be experienced sewists. So we put them to work, and we're paying them to produce those cloth face masks. And so we're doing what we can. We're not able to employ every military spouse in the state, but we were able to help 20. And it's becoming a strain on our resources. We have 5 case managers, and each of us may handle, at any given moment, 20 to 30 active cases throughout the year. It'll probably be between 70 and 100 per case manager. We're just trying to keep up, trying to prevent us from being burnt out. So we're partnering with organizations like the Cohen Clinic. So the local Cohen Clinic here has offered our staff, they've offered to see our staff because they know what kind of stressful situations that we're dealing with right now. And COVID has complicated not only what we're doing, but what the partners we're working with are doing. So when we're working with incarcerated veterans, now we're working with a court system that is also impaired by COVID. So, the VJO can still reach out to them and do what they need to do, but they've got just as many hands tied behind just as many backs as we do. It's just a hard time for everybody, and it's sort of do what you can mode right now.
So really, my next question, you sort of answered it, which is how has your service delivery remained agile during the global pandemic? So it's really just kind of a constant struggle and keeping communication going between partners. And any other things that you've specifically done? And I know you've gotten that support from the Cohen Clinic for your staff, which is really great, because I think one of the things that we're hearing about is that there are a lot of mental health issues as part of the fallout from COVID-19 and the isolation and the burnout and the worry and the finances. So are there any other tricks of the trade that you've been using to remain agile?
There was never a time before now that we've ever had such a focus on trying to improve our workflow. We never had so many cases coming in on a daily level that we had to address how quickly we were helping them. Now we're looking at it and we're saying, well, if we're not getting these cases finished in time, they're just going to snowball and we can't handle it. So now we're looking at our internal processes saying, all right, now how do we adapt these to a higher funnel of people coming through? And the opposite end of that coin is how do we modernize, but without making ourselves irrelevant, right? So I can completely automate the system. So where you go onto our website, you type what you need and all the forms pop up and you just fill it out, upload the forms, and then it comes to us and it automatically goes to a VSO and they get everything, right there same day. But that defeats the purpose. They want to sit down with us. They want to talk with us. They want to ask questions about what they're filling out. And so we're trying to find that perfect balance. And it is complicated given the wide degree of accessibility there is in the state. Right now, I'm working with a client who's on an island, probably about 70, 80 miles off the coast of Alaska. He's probably closer to Russia than he is to Alaska. And we're trying to communicate entirely by fax. It's complicated. It's the only way we have, and they don't always have that service available. So we're communicating almost by smoke signal. It's when we can, when the conditions are right. And it's challenges I never thought I would be faced with, but like Kari said, it's certainly keeping things interesting.
Yeah. And you're not giving up, and you're figuring out ways to make it work in some sort of unprecedented for us circumstances. So good work.
Exactly.
Yeah, I got one thing to add, if I could, please.
Oh, absolutely.
Yeah, so technology is, as far as COVID, when this all started back in March, I, I thought Zoom was a television show I saw as a kid back in the 70s. But, we've learned this in ways it's become more efficient and more time saving and useful and easier for a lot of veterans just to dial in Zoom to their service provider. So, instead of having to drive through traffic and park and walk in and get an appointment, all that, they dial in and talk, see somebody face to face and actually get that sense of communication that you're being listened to and responsive to you. But we also found that a lot of organizations are doing the same thing. So we held our career pathways night for employment at the Tyranny Center and invited, a business sector to come in and talk about what was available and how you get into that sector of business and what do they have open. We actually get Blizzard Entertainment and Turtle Rock Studios to dial in and do that virtually. And we had over 50 veterans dial in also, all interested in gaming and tech data. And they were actually able to ask questions like we're doing right now on chat, get the answer immediately from those organizations. And they left a feeling of, I can get into this industry. I know what I need to do. I know where the website's at. So that was very useful. And then we also had organizations like PIMCO and volunteer and say, hey, we will look at your veterans' resumes and we will look at their and do a kind of rehearsal with interviews. One. So if we get a list of your veterans, we will get a list of our employees and tie them together and ensure that's done. And so that worked for a lot of people also, just getting that extra help from industry.
Okay. Kari, talk to me about leveraging volunteers. I think that's something that you all have been doing during COVID-19, I understand, for your agility. Tell me a little bit about that.
Yeah, I think this has been one of the most heartwarming parts of working in this time is we found an incredible energy in our communities of people that are feeling like they want to do some, like, how can I make this better? What are actions I can do to help out? And so we've tried to tap into that by really looking at our military and veterans serving organizations to figure out what are their needs. And coincidentally, they've been having high volunteer needs as well in some areas. And they had tapped out of their database of volunteers. So we've really worked to connect them, really figure out what are the volunteer needs of our veteran and military serving organizations. And we've expanded that to include all community organizations that might touch on veterans. So the Meals on Wheels, they do incredible programs for veterans. How can we get volunteers in our community to support delivery of those meals as their needs have increased? Masks was a big one early on. David, you mentioned that. How do we get masks out to our, we had a number of active duty that were getting ready to deploy, and without masks, they couldn't leave their quarters on the ship. They had masks for when they were on duty, but when they were off duty, they didn't. So tapping our community to say, hey, this is a need, get it out there. And we were, it's been really exciting to see when you can connect those two needs, when you can connect people that are so ready to give back and do something. Now we have to be creative sometimes. We can't, all volunteer needs, a good number of them are changed. We have to meet COVID policies that continue to change, right, on a monthly basis. So we got to be creative, but that's really been exciting for us. And we're now seeing, whereas food delivery, basic medicine delivery was a key part in that early time. You're now seeing how we can help some of our military families with young kids. How can we help volunteers with people that want to do networking for careers? So it's something that we're continuing to look at and adapt to. Thanks.
Well, thank you. Thank you all so much for those insights and ideas. I want to move now to our questions. We have about 10 minutes, so I'm going to run through these really quickly. First of all, we've got someone asking how do you crack the nut on creating a collaborative in your community? We've had several. We had a gentleman from the UK on here asking that, and we had somebody from one of our states asking that. So how do you get into a collaborative? How do you, as a person in the community, if you want to collaborate, how do you do that? How do you join a group like yours? Either anyone jump in if you have something to add. Denton.
So a couple of collaboratives. One is at the Attorney Center. This has really been a habitual relationship of organizations that work together, refer to each other often. It's who's your go-to if you have somebody who walks and needs food or behavioral health or legal help to go to. And we've been able to kind of develop that out further to a county collaborative. And now it consists of 108 organizations. So online membership, sign up, no fees, and pick the working group that you want to belong to. But one structure that's helped us get a little bit more organized is the Community Veteran Engagement Board. So VA's program of the CVEB, Community Veteran Engagement Board, and it's usually by county or region, but we got designated the Community Veteran Engagement Board for the county as our collaborative organization. And because of that, I was able to go to DC and do some work on what do we provide to them to help understand our community and in better service. I know Eric Faulkner's on here, he's my regional rep, and I've been able to give him either problems or highlights, best practice types of things to him to pass out of the nation really through that CVEB program, which I think is about 150 strong now. So that's one route, is to take your committee and look at becoming a CVEB through VA. It's hard getting the word out as far as what your class is and the resource you provide. We formed a PR group just for that. And so when we have an event, we try to at least get the printed, radio, TV press there, and invite as many as you can to take part in that and get the word out. So that's probably our biggest challenge, is actually marketing and ensuring that veterans and families know we're available and that easy resources online or in person.
Okay. All right, so I have another one. What, if any, success have you had with initiating continuity of care agreements with VHA facilities locally? If you have had success, describe what this looks like, please. So, continuity of care agreements with VHA. Anybody had success with that or has tried that?
I guess clarification on that, Jeanette. So continuation of care, is that continuity between the care they're getting at local providers and VA, or?
I'm going to say, I don't know exactly what he means. Just what success have you had in initiating continuity of care agreements with? So maybe between your organization and VHA facilities, maybe. Oh, let me see.
Yeah, so, you know, we've got a direct line right now to VA Health for us, Director of Hospital, Walt Brandenburg and Rich Beam. We're able to call them directly. And so the top of the hospital for VHA that we can reach, and that helps with continuity of care, coming to conduct classes on suicide prevention, on dealing with veterans with other issues. So now actually offer certifications for those. So we've got that relationship that we've built in, which gives us the opportunity to call if we need to get help. As far as an issue that's still going on with veterans is record sharing. So a capability to take your active duty service medical records and have VA be able to pull those up. If you go use Mission Act for it to be able to populate VA's database, those types of things technically are still in the process of getting fixed. And a lot of times can be frustrating for veterans. And we've yet to see how that's going to act through the Mission Act as more and more seek services outside of the VA hospital in some cases, that they go into the local communities and how those records and that continuity of care is continued on VA through that private provider, and how that ties together for the veteran family.
Okay. For your collaboratives, those of you who work in collaboratives, how often do your collaboratives meet? Kari?
I would say many collaboratives work on, meet on a monthly basis. I think it's key to get a regular schedule for meeting in the collaborative. And I also know AWP's done some great work and has a great book on some resources that people can tap in building a collaborative. I would say monthly, and it's got to be on a regular schedule. It's got to be set and anticipate. It's got to be on the calendar. If it's not, it gets lost.
And we are a coalition, so I kind of think of us as a collaboration of various different groups who are, they might meet with a regular schedule like monthly, but there's always meetings going on that are related to the coalition. So we probably have we have 4 alliance systems right now that focus on different areas. So we have an employment alliance, a legal alliance, a behavioral health care alliance, and a recreation and resiliency alliance. And those different groups all meet monthly in addition to the coalition staff. And so you'll find every week where we're meeting and collaborating. And that's if you don't even look at our outreach efforts.
For us, to meet each working group on a collaborative, so it's education, employment, health and wellness, family and children, they'll each meet as a working group monthly. And that includes any private 501c3s, nonprofits, or government entities that want to join that particular working group. They meet once a month. Once a month, we'll have all those working group chairs come in and have a steering committee meeting. So we briefing each other in all those areas and what's been done for the working group for that month. And then 3 times a year, we have a general meeting, which is usually about 100, 150 people attending. We've got a convener now. University of California, Irvine actually serves as our convener for our collaborative. So they assist with meeting a lot of the admin things that we need with. And that general meeting, we invite the whole public. So at that point, we're inviting in PR, we're inviting in local elected officials, inviting in other services. So we're actually briefing the community at that point 3 times a year on what we're doing.
Thank you. I've got one quick question. I think we've got maybe 2 minutes left. We've got a question from over in England. It says here, we don't have veteran collaboratives in the UK, but are keen to get something up and running. What advice do you have to give us at this early stage of development? So this could be for him or another community across the country that maybe doesn't have something like what you have. How do you get it started?
Start networking. Know who your heavy hitters are, who your key stakeholders are. Look at where you can funnel your resources best, where you're going to be most effective. So like our sweet spot is right in between the state's Office of Veterans Affairs and the federal Office of Veterans Affairs, and then like the VFW right here in front of us. We're very comfortable here, and that's what I recommend, is start looking at who's in the community, whose resources can you utilize, not duplicate, but utilize, or how can you supplement what's out there? How do you make yourself unique and useful, more importantly? Because what I often find is, especially when we start thinking about new organizations or new endeavors, is more often than not, we didn't take the time to look and see that there's already those resources there. And maybe my efforts would be better spent just promoting those resources or supporting what's already out there. In our case, 10 years ago, it happened to be, it was best to just conglomerate all of the different efforts. So we're a conglomeration of both the military and the state and the federal government, all sort of looking in the same area. What can we do? How can we help? Oh, we're all doing the same thing. All right, let's do it together then. So you never know. You may be the person that actually is that linchpin, is the catalyst that pulls those resources in the community together. So just be aware of what's out there.
All right. Thank you so much for the comments and the experience. I'm going to turn this over to Allison to wrap us up.
Thanks everybody. I want to thank all of our speakers today, Jeanette, Denton, David, and Kari. Thank you guys for being here and giving us such wonderful advice. A special thanks goes to our sponsors who enable us to have our wonderful symposium for those who attended, and also this post-symposium and community integration seminars. America's Warrior Partnership's mission is to empower communities to empower veterans. We hope that today's session, Serving the Veterans, offering holistic support through collaborative services, provided you with powerful insight and best practices for working together within your community to improve the quality of life for all veterans. We encourage you to start thinking about how you can do more to reach veterans before crisis occurs. We encourage you to start thinking about how you can proactively serve them and help them continue to rise up so they never fall down. We must do more. It will take all of us together. Veterans are assets to your community, and you can best support them by improving the community as a whole. We hope you would have enjoyed our 3-part series, and please keep an eye out for the recordings and for our invitation to the Battle Rhythm for October, which is promoting positive mental health and practices. So keep an eye out for that information and for next year's symposium invitation. Thank you guys all for being here today and for your engagement and all that you do for veterans and their families out there. Have a great rest of your day.